what is the treatment? This is a conventional treatment, is that based on two lies. There are two lies of diabetes, two big lies of diabetes. The first lie is it is a progressive disorder. That's the biggest lie. The second big lie is treat the sugar. I have added third lie, control the sugar with insulin. That's the biggest lie. Okay. So conventional treatment is what I was a conventional doctor until 2.5 years ago. Then I flipped. Something happened, no? It flipped. So see, the treatment is like they say, lifestyle modification. Okay. Regarding diet and exercise, neither doctor nor the patient knows what diet and what exercise is. Then they come back with the sugars going up, then tablet, more and more tablet, insulin, multiple insulin, etc., etc. Okay. But nothing happens. It comes down and then sugar goes up. Because diabetes, it is an intelligent expression to a physical, chemical or emotional response. It's an emotional response. So the body is intelligent. You say, you guys try to get my sugar down with chemicals, I'll push it up again. That's what he's saying. You are not taking care of me properly. So this is what is happening. Because it is again the cause effect theory. The general perception of all medical practitioners is that diabetes is sugar. So they treat the sugar. We are all glucocentric. Not me now, but we are all glucose. Glucose means sugar. So our treatment is oriented towards sugar. But the real culprit is insulin resistance. A patient comes to me with 10 to 15 days fever, and I make a diagnosis of typhoid. Typhoid is a disease, the cause. Fever is the result, the symptom. Suppose I treat the symptom by giving some fever reducing medication, is he going to be all right? Certainly not. So diabetes பொறுத்த வரைக்கும் insulin resistance is the disease and sugar is only a symptom. You treat the sugar, nothing happens. It comes down and again goes up. Okay. You can treat sugar only with medicine, be it tablet or tablet and insulin injection. Okay. Medicine has always got another M tag to it, that is money. When you treat insulin resistance, there is only one treatment, that is diet. There is no money. Now you know why diabetes is being treated the way in which it is. You can read between lines. It is for you to understand. Whether it is being done with or without knowledge. If it is done without knowledge, ignorance is not an excuse. When it is being done with the knowledge, then it's got a different dimension altogether. That is something different. So we can't do anything about it. The pharma industry and the food industry and the medical industry, it's an industry. It is very, very powerful. Okay. We can't change them, but we can always change. That's exactly what we are trying to do. Right? So what do we do? Now I told you, diabetes, type 2 diabetes is only a dietary disorder. It cannot be and should not be treated with medicine. So what is the alternative? It's very easy. The culprit is the insulin, high insulin that is not working. So what do we do about it? You take a food that does not stimulate insulin. Now let me repeat, carbohydrate elicits high insulin response, very high insulin response. The more refined, the more high insulin response. Protein moderate, fat very little. So what is the diet? It's logical, very, very simple. It's so simple that people can't see it. So you go on a very low carbohydrate, moderate protein and high saturated fat. That is known as LCHF, low carbohydrate, high fat diet. So what happens? Now you switch over to this diet, the carbohydrate content is very, very low, there is no insulin response. Slowly the level of insulin comes down, insulin resistance becomes insulin sensitivity. Insulin will do its job. What is the job it does? Remove the excess sugar and keep the sugar under control. That is exactly what we are doing. So change the mindset of the people, give them the science, make them understand make them follow, you see results. It's not rocket science. It's simple. I have not got it from any planet. It is in the internet. All you have to do is search. Having said that, it's not going to be a very smooth journey getting into this sort of diet. That is why I always say it's like launching a rocket. You require boosters to launch a rocket. Okay? Once it goes into the space, it's a different thing altogether. There is no gravity. Okay? We people are being held by the gravity of our beliefs. All of us. I was. Okay? Firmly grounded by gravity. You have to challenge beliefs. After all, beliefs are to be challenged. We are challenging that and say you get off the gravity. It's going to be difficult to launch yourself. Once you get to a particular place, you are in a different zone. You will be orbiting effortlessly as these people are. We are never hungry. You are always full. Okay? When you take carbohydrate, you will always feel hungry. As I told you, you are always energy deficient because all the energy is being pushed to your fat. You tend to eat more and more. This is where the diet aspect that has been taught in the diabetic center is all wrong. They may be experts within quotes, they may be diabetologists within quotes, they may be my professors, peers, whatever it is, they got it all wrong. What they do is a proverbial குழந்தையை கிள்ளிட்டு தொட்டில் ஆட்டுறது. They give you a menu which contains a lot of carbohydrate, drive your sugar and then treat you. All I am doing is just knocking off the carbohydrate, become all right. So that's the sum. That is so. I conclude this diabetic issue stating that type 2 diabetes does not require any medication. All it requires a dietary change.